You're listening to The Outcue, a 21 News journalist perspective on a top news story.
Good afternoon. It is Friday, August 23rd. I am Assistant News Director Justin Mitchell, and this is The Outcue. And this week has been a heavy one in the Valley and in Mercer County as well, with the announcements of the impending potential closures of several Valley hospitals: Trumbull Regional, Hillside Rehabilitation, Sharon Regional, and many of the satellite offices as a part of the ongoing saga of Steward Healthcare's bankruptcy. Now, we've reported on this for a long time, and every little detail as it comes out, there's been a lot of moving pieces, as well as efforts to save both hospitals and the impact that such closures would have. So this week's Outcue is going to be a little bit different from what we normally do. Normally, we will take you behind the scenes of how we told a story. But since this story is right in the middle of it and we'll be telling it for a while, this is more of an effort for us to, in one place, discuss what we know, what we don't know, what we're still looking for, and whether there's an end in sight to the uncertainty or any sort of a happy ending here. So with me is, as always, by my side is senior digital content manager, Robert McFerren. Now, Robert, I've had a couple days that I wasn't here this week. I've been following this in the newsroom and also out of the newsroom. And a lot has happened, and the impact really cannot be overstated. We know how damaging it was when Northside Hospital closed in Youngstown. We're talking about the potential for 3 major hospitals and satellite offices here whose future is very uncertain. So I guess let's just start there. What do we know and what happened this week from Monday to now?
I mean, going through all the court filings that we've looked at and read through and listened to, we know that, the time is running out for all the Steward facilities. They're bankrupt. They don't want to fund these anymore. They want, to start filing the war notices to get these employees off their bankrolls. So in the Valley alone, we've got, almost 1,000 employees between the 2 hospitals plus the satellite facilities. We've got Sharon, which has hundreds of employees over there.
I believe the largest employer in Mercer County.
It absolutely is. Yep. So the impact of the loss of these jobs, and this is a little bit different than other hospitals we've seen, Northside or whatever. There were other hospitals to go to. We don't have really that option for all these nurses or these doctors to go to other facilities and stay here in the Valley and keep that, the tax dollars coming here, which support our cities and support our infrastructure, supports our spending for, the people of the Valley and how the economy works. So
sure. Now, we do have Mercy Health saying that they'll be able to take at least some of the potential fallout, and they do have some new hospitals on the horizon. But to that point, that's still part of the uncertainty. Those are not things that are built now. Those are not things that are ready to go. It seemed as though this week, this speculation as to what might happen, which of course is not new to anybody. We always knew Steward was going through bankruptcy. That's not new. The fact that it was not quite clear what it would mean for these hospitals is not new. But up until this week, it seemed that the tone really was, we're probably talking about acquisitions and a transition to some other kind of a company. We've reported on some of those kinds of companies, but it seemed like Steward's position got a lot more aggressive this week and not in a positive way.
It definitely did. They in listening to the Sharon story yesterday with the phoner that they were doing with the court in Dallas, Texas, their argument was, who's going to pay for this? If you want to give an extension to these hospitals, at whose expense? Because we're done funding this, and that's why they want to send out the warrant letters, which means mass layoffs for these facilities. And they were basically saying, we don't want to fund this anymore. Someone else either needs to step up and buy these, or we're done.
They told the state of Pennsylvania in a notice in all caps. It was almost like something out of a movie. It really read like you would read something like a ransom note.
You pay us
$1.5 million by tomorrow, or we're shutting this hospital down.
Yep.
That was a whole new level of aggression here.
Yep.
And you can only imagine the ripple that sends through that hospital when you've got organizations like the Buell Foundation looking to try and
Right.
find ways to save the hospital. You've got city leaders, you've got the Mercer County commissioners, you've got unnamed entities that have shown some interest. And all of a sudden, what seemed like time running short sounded like time had suddenly run out.
Right, because I mean, with the factors that are going on, I mean, it's one thing to take over and acquire a hospital that has employees. If it shuts down, those employees are going to start moving on, and it's going to be much harder to put everything back into the cart.
And then a similar situation with a little bit less of a dramatic moment, but we had this announcement about Trumbull Regional and Hillside that they would, I think they use the word closing process, which you always love these business terms that are full of unnecessary extra words. It's not the closing process. They're either going to close or they're not in 30 days.
Right.
Now, we have previously reported on a local effort to save at least Trumbull Regional, but they're raising money. They needed time. Now, last we had heard, they had raised roughly 10 million of 15 million they would need to purchase the hospitals. Now, we did learn more today about that plan, so let's talk about that a little bit.
So one of the investors looking in this, John Woods, talked with us today, and he explained they have the money now to buy the hospital, to buy the properties, which we also learned includes Hillside, which we had not reported on that before. So, and all the satellite offices. So this is good news if this can happen. So, and we started looking into, you know, what does this mean? So if this can happen, but they're also facing the same time because the warn notices were filed this week. So we know we have, you know, the deadline to hit, that they have to get this done in a certain, you know, the 30 days, or otherwise, you know, the employees are going to be gone.
Well, and they're talking about an even shorter deadline to raise the money. I mean, they're talking about the financial plan that will be filed by Monday unless things change. And now John Woods has been very, very clear to tell us in bankruptcy, there are always moving targets. So Monday is the date as of the time that we're recording this, and it may have already changed by the time that you're watching this. But that's the date right now. But they need another roughly 27 million because buying the hospital is almost the easy part.
That's the assets, right?
Because then you need enough to operate the hospital until you've brought in enough money to kind of think of it like riding a bicycle. Like you can sit on the bicycle, but you've got to get it up and rolling. And so they need another, you know, roughly $9 million a month for 2 to 3 months.
Right. So, I mean, if we're doing, you know, any type of medical, the billing procedure, you know, by the time we bill and all, there's going to be a time lapse before money starts coming in. So they're going to have enough to keep them, let them give them a fair chance to get on their feet and walking. You know, obviously they're going to crawl and then they're going to walk it before they can run.
And so this group is obviously looking to get help a lot of different ways. They've filed and they call themselves Warren City Hospital Incorporated. So when we talked to them last, they were seeking help from a few nonprofits. They had hit a little bit of a roadblock because the Trumbull Memorial Foundation, which was the nonprofit arm of Trumbull Regional from its foundation, was not initially willing to provide any sort of funding. They said because this group was not a 501c3 yet. It was pending from the IRS, but it wasn't yet. And that was a hurdle to overcome because they needed to find what's called a fiscal agent. Now, it's hard to explain that in a news package. It's rather easy to explain. You want to be a nonprofit, while you're waiting to become one, you can find a nonprofit who will essentially sponsor you while you're waiting to become one, and you can raise money. So they were seeking one, and they kept thinking they had one, and then they didn't, kept thinking they had one, and then they didn't for various reasons. Now they say they have one, and the Trumbull Foundation, as of today, says no promises, but that was the hurdle we were waiting for, and now we can start talking. And then other entities who are also, you know, non-committal. Jobs Ohio, for instance, told us today that it's not really their purview to give money directly to hospitals. Now, they didn't elaborate any further, and their website lists healthcare as a specific sector that they help out, and there have been situations where they have helped hospitals in other parts of the state. That said, they are talking about
Right.
ways that they can work with the local partners. Um, I'm almost, and I'm not trying to ramble here. I'm really
Yeah.
saying all of this because I'm trying to make sure I have it all straight.
There's a lot of moving pieces in this, and it's changing not even daily, it's hourly, sometimes by the minute, that we're learning new things that are happening or moving. I mean, speaking with John Woods today, who said, he's more optimistic today than he's been, in more recent days over time. So that, which is positive for everyone that's hoping this does happen.
Right. Well, he told us today that he's hopeful that the state can step in somehow.
Yes.
And that was been a roller coaster too. I
Yeah.
mean, he went
Yeah.
from being, trying to reach out to people in Columbus and kind of getting nowhere. And then he got, he says now he's got the ear of, help me out here. He said the
Yeah.
governor's office,
Governors.
the lieutenant governor, the auditor, the
Auditor.
treasurer,
Correct.
As
Yes.
well as we mentioned, pseudo government entities like
Yep.
Jobs Ohio
Yes.
and a lot of the Valley partners that he's working with. So that's I think the way he said it to Lindsay for our 5 o'clock broadcast today was there were 30-some billion dollars in the Ohio budget. He surely hopes that there's some for Trumbull County in there.
Yeah. Yeah, the impact, I mean, if these were to close, and I mean, we've gone through this before, we've seen it when Lordstown, GM Lordstown closed, but, those people transferred and got other jobs, for the most part. But in this case, you've got, there's a large supplier base that comes right here from the Valley. So it's not just these 1,000 people plus, the Sharon, a few hundred there. It's that, I went through the court listings and was looking through how many people have contracts with, and it was 150 pages of businesses that for just Trumbull Regional that they do business with. So, I mean, and there were a lot of local businesses on there. So if they were to leave, it's a trickle down, but this is going to be, if this happens, it's a quick flood that's going to hit our valley once again.
And many of them have, many might be a loaded word, but several have filed their own suits against Steward for bills not paid.
Yep.
So they're really hoping somebody can come in
Yep.
and do business with them, and they get their bills paid.
Yep.
And it could be the end result of this still has the potential to be a net positive for the Valley,
Yep.
depending upon who can take over these
Yep.
hospitals. If they are taken over, you could be talking about somebody who does not carry the baggage that Steward Health has carried, and you could have a better situation, an improvement in quality of
Yep.
care. I mean, there are a lot of promises
Yep.
being made, but it's a lot to get there.
It's a lot, and there's a lot of hurdles, and we're economically challenged here, so it's always a bigger risk for hospitals, in these groups. We did talk with an expert yesterday from Harvard who spoke with Corey McRae and was talking about here's some of the hurdles you're going to face, but here's some of the positives that come out of this as well. So there's a lot of things that you have to look at, but it can be done.
But this is an underserved population, and that's in Sharon and that's in Trumbull County.
Yep.
These are populations where most health surveys will show that they are not healthier than the rest of the country. In some areas, particularly areas like infant mortality and mother, maternal
Yep.
mortality,
Yep.
they're among the worst in the nation.
Yes.
So this is not a small thing to lose a healthcare facility,
No.
even if there are others who can take up some of the space. The quality of care, there's only so many physical structures to put
Right.
people, and we've needed for a long time to improve the quality of care, and that's with the hospitals
And
we have.
right, and we went through a pandemic, which we saw how quickly hospitals can fill up when bad things happen. So it's and if we have fewer beds, it means more death. Obviously, that there's not a chance, for these people if they can't get in, there's no room. It could be lead to a bad situation.
And now we're talking physical illness. That's not even to account for mental health,
Yep.
which Trumbull Memorial has. Do we know off the top of our head how many beds that they have specifically for mental health?
I did know that, but I don't know it off the top of my
Right,
head.
but it's a significant number.
Yeah, it
And they're
was.
the only ones with that. This is
Correct.
not something that can easily be swallowed
Right,
up.
and-
This is a gaping hole that will be left
Right,
in the.
and Mercy is building a facility, but again, they're building it. It's not here yet. So what do we do in the meantime? What does anyone who has, someone with mental health needs, what do they do? It's not an easy, because we know, it's if the cops get called, well, where do they go?
Right. It's not as though we have all sorts of facilities. This is, again, we report regularly about the healthcare needs, mental and physical, of this valley, and that's through the baseline of the existing facilities. So if those existing facilities were to fall away exponentially, as is the potential, then yes, Mercy Health is there and they will stand ready and they will do their best. I have no doubt
Yeah.
about that. But the fact remains, there will be that much less available
Right.
in an area that is already in need with the existing facilities.
Yep, exactly.
I say all of that because none of this is a fait accompli. There are a lot of twists and turns that
Mhm.
can happen. So I guess together I want to try and think of the things that we're watching for moving ahead. For instance, okay, so bankruptcy, the financial plan to try and take over Trumbull, they're hoping to have it for the court by Monday.
Mhm.
Court will then need to approve it, and they will do that in their own sweet time,
Yep.
although it does appear that they work pretty quickly.
Yep.
And you look at that docket regularly,
Yep.
it's almost impossible to keep up with
Yep.
because every day, for some perspective, for people who don't read court dockets every day, um, as a general rule, you will go days without an entry and then occasionally an entry or two. So if you know where to look, it's fairly easy to keep track of. In the Steward Health bankruptcy, because of the scope of the broader company and the fact that it's national in its
Yep.
scope, every day there are 50 entries.
Oh yeah.
Easy.
Yeah, and so you have to find, trying to find our own just is
Right.
a
they
job in
don't-
itself.
Exactly. They don't all pertain to this area, but some that don't pertain directly will have references that
Yep.
do. It's
Yep.
a lot. It's voluminous what you've got to comb through.
Yep.
And so they need to accept this, they need to review it, and they need to determine. And then, honestly, and I'll plead my ignorance here. Let's say they accept the financial plan. I don't know what the next step is. I think it's raising the money still. Like, is that it?
Yeah, I believe so. Because again, it's for we're not the experts in this area.
Right.
We follow what the courts say. And I guess that's what if they have the funds and if the court approves. So I think because the debtors, who are representing, wanting their money because Steward Health didn't pay them, they have the right to object to these, and that's what we've been hearing is like they want their money and whatever they can get out of it. So if it means, giving me what I can, pennies on the dollar, let's take that. But some don't want to wait. It appears they just want but if whatever it lands on, that's kind of what we're gonna have to see. I assume that they do want to sell these because that would mean they would get more money than if they just shut
Well,
them down.
that's important also because that was something John Woods had mentioned to us when we did when we broke a story earlier this month. I think it was when we
And
first
the
talked to
time
him.
flies. Yes.
It does. Where he mentioned that it's if so a little bit about the structure of Steward Health because they are set up differently than other hospitals, and I'm not going to get too into the weeds, but they lease these hospitals.
Mhm.
So Steward Health doesn't own them.
Yep.
They have a structure where they own the hospital as a business entity, but the actual buildings are owned by a company called Medical Properties Trust. A big part of where Steward ends up in financial trouble is that they have massive rent payments to Medical Properties Trust that they found themselves unable to keep up with, among other things. That's a gross oversimplification, but that's part of it. So what Woods had explained to us is that it is his position that Medical Properties Trust, if those hospitals close, if Trumbull Regional alone closes, it would be something in the neighborhood of a $70 million loss on their books. So it is in their interest to not have that happen.
Right.
It's through that lens that you would hope that there's not a lot of objection, but they're going to quibble and I don't mean in Medical Properties Trust specifically. Anybody in bankruptcy court may quibble over little details, and then you need extensions or the judge not granting extensions. Eventually, there's sort of a rubber meets the road day, and it's going to happen within the next 30 days. There's either a plan that is approved and they can move forward, or there are extensions. But if you get past 30 days and Steward Health says they're closing those hospitals, then they close. Then you've got a real problem because all this bankruptcy stuff can still go on, but it's going on over empty buildings that would need to be refilled, and the whole process gets much, much harder.
Yeah.
Um, So we know we're looking for that.
Yeah.
And we know we're looking for what happens over the next 30 days. There's also a component of what the local leadership is doing. Today alone, there's a Trumbull commissioners meeting, which at the time we came up here was still going on. So I know that there was discussion over what funding they may be able to help with. And there is a Warren City Council meeting for the same purpose, starting in about 2 minutes as I speak. And we don't know what they're going to say. We don't know if they're interested in helping the Warren City group, or if there's, a question I have, and this is a question that we'll look into. ARP money. Warren and Trumbull commissioners have not spent all of their money yet, but I have no idea if this counts as an allowable expense. So they're going to have to figure that out very quickly if that's something they're looking at.
Yeah.
What else? What are we looking at here?
It's a lot. I mean, I guess we're just watching the ball day by day, minute by minute to see, and like you said, each day brings a new challenge of, is it going to happen? Is it going to stay open? Are the doors staying open? I mean, the clock is ticking now. We're hitting a deadline, so we know that it's either going to be a go or a no very quickly.
Now, the Trumbull County United Way has also stepped up, and they are acting as the agency that is helping to fundraise for this effort to save the hospital.
And asking people to, if they can, they have a button on their website when you go there that you can donate to help save this, because it is important for every one of us in this valley. It doesn't matter if you're in Mahoning County, there's offices here. So it's us as a group. It's not a them problem. This is an us problem.
This is one of those things that, and we've seen these, we've been at this crossroads far too many times in this valley, but this is one of those, we'll survive. We'll survive no matter what happens, but it's not, it's a blow that'll knock you down.
Yep, absolutely.
Those hospitals are crucial, and quite frankly, they need to improve care. They need to not only not go away, they need to get better. There have been a lot of reports during the course of this bankruptcy of various problems at Steward hospitals around the country. And so it's not enough to save the hospital. Whoever finally, assuming that somebody does, they're going to then need to really revamp the whole system.
Right.
And the understanding that everybody seems to have is that the people are there to do that. There's the people are doing everything that they can inside those hospitals.
These are all local people.
These are local people. They're professionals. They're experts. They're good at what they do. They're in a really insurmountable position right now. And so this is about them. This is about the greater communities. This is about, continuity of care. This is about improvement of care. And it is about the valley's economy. I mean, I think you cited this already, but there's hundreds of pages of vendors.
Almost 150 pages. And then you think, so that's just the vendors. Then this is all, so these people all pay city income tax to Warren because they work there. So this is all money that goes into the city for paving roads and doing whatever they need to do. But that also means that this is money they're spending in our community, in our local restaurants, at our local grocery stores. Everything's impacted. And if that money goes away, these people, their option, some will get other jobs locally, but some may have to move. And then that means a housing market, that is now has extra houses on it they have to try to move. And it creates, once again, we've seen it happen over and over. We've been in this, for 45 years now of, since the mills closed, and we've seen economic damage hit us once and over and over.
And we know we have shortages in certain areas of healthcare, but I don't know that that's true for every aspect of the people who work in a hospital. We know there's a nursing shortage. I'm fairly certain that there are shortages of certain types of doctors, depending upon what you specialize in. But what about, food workers? What about maintenance workers?
Exactly.
What about, sanitary staff?
Yep.
What about patient transport?
Yep.
There are a lot of people who work in a hospital that I've never heard a word about there being a shortage of.
No.
So they're not all going to just be able to bounce back immediately. No. And so then you're talking about retraining,
right?
And you're talking about a major strain. The suppliers at least have other places they could supply to. It's a hit, but they won't necessarily shut down. But you're talking about a human cost.
Oh yeah, and this is where Jobs and Family Services, they come in and they try to retrain people. So, okay, your field that you work in is gone, and we can retrain you to do other things. But again, this is a life-changing thing that no one really wants to go through.
Now, and you mentioned Job and Family Services, and I think you were telling me earlier that they would normally, when the WARN notices go out, immediately start reaching out
Yep.
for retraining and those sorts of things.
Yep.
They're not doing that yet, though, right?
No, and I spoke with them yesterday, and they said that, you know, they want to just hold for just a minute. Normally, they would have been in there day one saying, okay, we're going to offer ability to help you guide you through this process, but they want to hold because they're optimistic as well to want to see, you know, if these sales go through, I think they want to preserve these jobs if possible. So that's the ideal goal for everyone, is if we can preserve this, we don't have to go through, you know, this all over again.
And so the tone of all of this that we've been talking about has sounded very almost apocalyptic. I mean, but that is, it can't be stressed enough that none of this is a fait accompli.
Nope.
None of this is a done deal.
Nope.
It is absolutely still possible that these hospitals can be saved and improved upon.
Yes.
We've talked about one effort. It is also possible that some other dark horse comes out of nowhere and you end up with a bidding war for the hospital. I mean, there's any number of things that could happen, and they could be good or they could be bad. The one we know about right now is the Warren City one in Trumbull County and the Buell Foundation in Mercer County. So that right now, in Meadville, right?
Yes,
they're looking at Sharon Regional also.
Yep.
So there are a number of ways that these hospitals can be saved. So right now, what we're just talking about is the impact and the importance of this happening. And you know, as Robert mentioned, there's a button for the Trumbull County United Way for people to help any way that they can.
And there's a web story up. You can go click on the links. They're built into it on our website.
And I mean, we're obviously, you know, we're not in the position of advocating for any one group, but we are in the business of advocating for our community. And there's no question that it is not good for our community if these hospitals close. Yeah. So I don't think that I'm stepping out of, you know, editorial decorum when we sit here and say that something has to happen, and that it'd be devastating if it doesn't.
Absolutely.
You know, is there anything else that you're really watching for right now, or what the next steps are? Do we know when the next bankruptcy hearing is for Steward?
Well, there was the one that was supposed to be set, like for Sharon, it got kicked to August 30th because their deadline for the 1.5. But I've got to look again. Yeah.
It changes regularly. So it's hard to even keep up with.
And we look at it daily, but
But again, I mean, it's voluminous. So with that, I mean, I guess all I can encourage everybody to do is to keep a close eye. If you are inclined to help in any way, by all means, reach out. Robert mentioned the links in our web story. If you, we have some reach on this. There's people that watch this from all around the country. Hey, if you happen to own a hospital system and be interested in seeing how you can help or offer some expertise, you know, this is going to be crucial, and it's going to be something we're going to be following for a while now. And hopefully in the coming days and months, we're talking about a Valley coming together, sort of a success story, and not a more familiar story about how we cope with this. With that, I will always remind you that you can reach out to us via news@wfmj.com, watchdog@wfmj.com, or call us in our newsroom at 330-744-8821. It would be my hope that by this time next week, we can give you an update that's a positive one, and we may very well bring up this topic again, but this is very, very fluid. So until then, this has been the Outcue.